Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. March is Colon Cancer Awareness Month, and we've got a short video with Baptist Health and the CDC to talk about colon cancer prevention.
Colon cancer is a common cancer, kills a lot of people, and in many times is preventable. The risk factors for colorectal cancers are: number 1, living in the developed world; number 2, having family history of colorectal cancer; number 3, smoking; number 4, obesity. And then in addition to that, eating excessive amount of red meat. These are the major risks for colorectal cancer.
Colon and rectal cancer used to be the 4th most common cancer causing death in the United States, but it's become the 2nd most common in women and the 1st most common in men. Here in Kentucky, we have the highest rate of colon cancer in young people that are less than 50 years old in the whole country. Current screening protocols call for everyone to be screened by age 45, but some people need to be screened earlier. If you have family history of colon polyps or colon cancer or certain symptoms, it's important to get screened earlier so we can help people identify those problems and make sure that they get screened in an adequate time to detect their disease early or prevent it from developing altogether.
The Kentucky Colon Cancer Prevention Project has helped with regard to education and advocacy. There's been an increase in screening in the state of Kentucky and allowing us to detect polyps and colon cancer at an earlier stage. Colon cancer is detected many different ways, but the way that we primarily detect it is via a colonoscopy, which is an examination of the large intestinal colon to detect a growth in the colon, and once it's biopsied, you can determine that may be a cancer process. The procedure is generally outpatient. We have a surgery center here at Baptist where we do most of our colonoscopy procedures, and generally the examination can be done within 30 minutes from the time the patient's in the room to the time they leave the room.
I'm Sandy.
I'm Erin. Nice to meet you.
Nice to meet you.
Isn't this wild that we're doing this?
I don't know what to expect. Thank you.
Can you tell me why you got a colonoscopy?
When I was younger, I was having issues with constipation, and my PCP was very proactive, and he recommended that I seek a colonoscopy.
I decided to have a colonoscopy because my doctor told me I needed to at 45. Tell me more about your prep.
You know, you drink the solution, you take the pills, and then you stay by the toilet.
Ballpark, how many poops did you have?
Oh my goodness, really? You're gonna ask me that? I did not count, but it was several trips.
I couldn't get far from the toilet at all. I have to admit to something. I actually set up mirrors so I could watch TV.
What do you think would be helpful for others to know prior to getting a colonoscopy or colon screening?
Don't eat beans before you do your prep. You really need to follow like the dietary restrictions before you get it. Because I had too much fiber before it, I couldn't go, and then we had to reschedule it.
How was your recovery after the procedure?
It was like the deepest sleep that I went in, and it went by so fast.
I totally agree with you. I remember waking up and I said, did we start? Have we started? And they're like, we're done. And I said, you're kidding.
It was like it never happened.
Did your doctor discuss your results with you immediately?
Yes, actually, once I was awake enough, they did talk to me about my results, and thankfully, they didn't find anything and said I didn't have to come back for another 10 years. At the end of the day, is it worth it?
For the inconvenience you go through, the peace of mind that you get is definitely worth it.
Yeah, it was definitely worth it. Well, it was really nice.
It was nice to meet you.
Thank you for sharing like all your funny stories.
Oh, I know. Colonoscopies aren't very well talked about, but yes, I do agree that it was nice sharing our experience.
Screening is very important because what you can do is detect polyps, which are growths in the colon that can be removed before they're able to get larger and develop into a frank cancer. Colon cancer is very treatable if detected earlier. If you detect this at an early stage of stage 1, the survival rate is very good, over 85-90%.